Hey, future medics, Tina here, your medic mentor, and today we're finishing out our IV fluids with one that's a little different than the two others we've already learned, and it's D5W, or 5% dextrose in water. D5W is made up of 5 grams of sugar per every 100 milliliters of water. So if you did a 1 liter bag, you would have 50 grams of sugar per all 1,000 milliliters of water. Now, the dose on this is dependent upon what you're doing because mostly this one is a carrier for the medication. You'll see it in EMS for us to dilute and infuse amiodarone or diltiazem. So while the onset is immediate, it's still given IV or IO like the other fluids we saw. The dose is more about the medication itself than this fluid. Now, D5W could be a little confusing, so let's break it down. When it's still in its bag from the pharmacy, labeled, closed, it is an isotonic solution, just like we've already seen. The problem is, when it enters the body, the dextrose within it quickly gets metabolized away, and what we're left with is just free water. And that water does not have the same osmolality as the rest of our body. So it is a hypotonic solution, which can lead to some fluid shifting. So more than this being a way of fluid resuscitation, like the other medications that we saw, saline and ringers, it's more of a medication delivery and a way to give fluid and sugar. Even though this seems very mild, D5W does have its risks. It's going to be contraindicated in patients with head injuries and ICP because it can cause fluid shifting into the cells, which means it causes cerebral edema. So if we have someone with a head injury who already has intracranial pressure, it's going to make that worse, and we don't need to do that. Other than that, there's not that many hard contraindications, but you do need to remember this is not a resuscitation fluid. We're not going to be given this for hypovolemic shock. That's not its job. More think of this as a vehicle to deliver other medications that need to be dripped in with a little sugar boost. Here's your takeaway. D5W is more of a supporting fluid than a rescue fluid. Use it to give medication drips. Use it to support sugar drops, but don't expect it to resuscitate your hypovolemic patient because it can't. And we don't ask things to do what they can't do. Okay, that's another section, not just one card, but a section of drug cards knocked out. You're doing so great at this. I'll see you for the next one.